Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about, are you ready to take your medical coding exam? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you are preparing to take your medical coding certification and you're starting to get those nervous feelings and you're just wondering, am I ready? Or maybe this is your second or third attempt and you're just really kind of nervous and it's just sort of taking over. And all of the things that you've learned, you're just sort of starting to forget because you're getting overwhelmed with these feelings of fear about not passing this exam. So I want to talk about, how do we know that we are ready? You're always going to feel like, maybe I'm not ready yet, I'm not ready yet, I'm not ready yet. But I think it's important that we need to set some rules in place about like when we should be ready. So we need to go ahead and attempt it anyway, whether we feel like we are completely ready or not, because by this time we should technically be ready. Okay, so just follow along here. All right, so if you have gone through a fast-paced medical coding program, meaning that your program has prepared you less than 6 months. Some people say, oh, I was trained in 2 months. Some people say I was trained in 4 months. Some people say, oh yes, I'm from the medical field, so I can be trained in less than 6 months. No, ma'am, no, sir. Never. I will never recommend that for anybody, any new medical coder, because it is so much that we have to learn. And I'm not saying this to, question anybody's intelligence, never. But what I am saying is that I want people to be successful. I want people to set themselves up for success and not feel like you're having to rush through all of these things that you're having to learn, okay? You need some time to soak it in. If you are in a program that is 9 months, 12 months, or 18 months, that is great. If your program was 8 months, but you're taking a couple of months to study, that's okay too. I tell people that you really kind of want to set a date. As soon as you finish your school, you need to set a date and be firm on your date, because if you are just ambivalent and like, okay, well, I'll take it in a couple of months when I save up enough money to take my exam. You knew that you were going to have to sit for a certification exam, and you knew you were going to have those fees. So while you were in school, you need to be putting that money aside, okay? And I know times are hard and it's tough. I get it. I was there. Okay, guys, I was there. So I do know how that goes. But I also know that I worked several jobs so that I could get that money that I needed to take my part of the exam, because I did have help with the WIOE program, okay? But I still had to put out a little bit of money too. And so that's something that you really need to kind of think about when you're preparing for your exam. So if your program was like, say, for 9 months, and you say, okay, well, Blue says that that's a good amount of time to go through. It's a little fast still, yes. But it's still enough time to sort of grasp what you're doing, especially when you're putting in the hours and the time. If you have no job, you should be putting in 40 hours per week. If you are working a full-time 40-hour-a-week job, you need to be putting in a minimum of 20 hours per week. That's how you know, because that's your foundational work right there. Because you're taking the time to practice and to study, to work on your speed. That's the thing that gets a lot of people. Well, Blue, I ran out of time, and that, I was just so nervous that I forgot everything. If you've been working on your speed while you are in school or while you're in your study time, it's going to make it less scary for you when you are in your exam, because you're going to be so used to that rapid pace that it's going to be like, okay, I can do this. So the more that you practice and the more that you study and work with the actual book, the better off that you'll be. And when I say to study and practice, I'm not talking about, working on those exam strategies. They have those exam strategies out there where, you're doing process of elimination. Process of elimination will only get you so far, okay? And it'll only take you so much in the exam, but it's not going to carry you through the exam. You still have to have an idea of what you're doing. So don't get dependent on those tactics, okay? The slow way is the fast way. And one of the channels that I watch, Think Like a Horse, the guy's name is Rick, and he talks very common sense. If you guys think I'm blunt, I am nothing. I am a smurf compared to this guy. Rick is very much in your face. He used to be, he was a former cop and he was in the military. So, you know, he's very direct and he's very, very blunt. So I admire him because I am blunt in my own nature as well. And a lot of you have experienced that from me. Sometimes when you're asking questions, I am very blunt because I don't feel like there's a need for all of this fluffy stuff. I am direct and to the point, okay? When I do talk on my videos, I talk because I'm a Texan and that's what we do. We talk and we tell stories and, you know, we like to have conversation. That's what we do. So I'm not into quick videos. You see my videos, they're like a minimum of 20 minutes because I talk. I like to explain things because again, the slow way is the fast way. Now, what does this mean? The slow way is the fast way means that you're going to take your time to learn so that when you are actually in the process of doing whatever it is, it's going to be much faster. And you're not going to sit there and try to wonder and think about and what are you going to do here? What are you going to do there? This is why I tell everybody, don't write in your books, don't highlight, don't tab. And people say, well, no, Blue, that's how I learn. That's how I learn. That's how I do things. Okay, you've never been a medical coder before. That's number one. Number two, I'm a veteran medical coder. Okay, I have sat for and passed 3 AHIMA exams, all on the first try. And before you say, well, Blue, I highlighted and tabbed my books and I passed on the first try. I'm talking to people who are wanting to have really good tips as far as like what they can do to kind of lessen that anxiety and things like that. Because I've had people who come to me and say, well, Blue, I was told to tab up my book and write all of this stuff, and I just get so overwhelmed looking at the book. Yes, because you're adding more to these manuals that are already written by doctors and scholars, so it doesn't need you to add anything to it. What it needs you to do is open it up, practice it, look at it so that you can get so familiar with those books that you will not need those tabs that will get in your way. They will get in your way and they will tear your pages in the book. And now if you're sitting for an AHIMA exam, you cannot have tape, you cannot have sticky notes, you cannot have any of those things in those books. Those books have to be clean. All right, so you can only use the tabs that came with the original book. The only one that I have seen on that approved list that comes with tabs is the CPT manual, okay? And it has its own tabs, and I have done a video demonstration of how to tab the book. But, because I say if you're going to tab it, you may as well tab it right, but I still don't recommend it, okay? I believe that if you are actually practicing and working with the book, you're not going to need those tabs. And the more that you practice and do those drills, do those 10-question drills and see how fast you can get through those. So that way that you can make sure that you're familiar with where you got to go in the book. You're not going to get so overwhelmed when you're in the test room looking at the book because you're already going to know this book like the back of your hand. And that's where you want to be. That's what you want to do. On my Patreon channel, and Patreon, if you don't know, is a lot like YouTube. Patreon, I do 10-question coding quizzes, and I also make crossword puzzles and word finds so that you can practice your medical terminology and your anatomy and things like that. So there's a lot of things that I do on Patreon to kind of get you guys engaged in like what's happening. I've been doing a study hall once per month, and it's just an hour where you come in and you ask whatever questions that you want, and we just sort of discuss. And so I think that that's just an added bonus of being on the channel on Patreon. So if you're interested, the memberships are listed on the page. There's different levels, and there's also different things that are added to, you know, as you go on higher levels. Some include one-on-one tutoring every month. So if you are interested in that, you got to check it out. The link for my Patreon channel will be in the description box below. If you're interested in checking out Patreon, again, in the description box below. But that being said, when you are working through like your workbooks, if you have what I've recommended before, which is a CPC study guide from AAPC, which I do recommend. Now, I'm with AHIMA all the way, but I do recommend the AAPC CPC study guide because it goes over the CPT manual. Now, all the 4 main medical coding certifications that I do recommend, the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, and even the CPC, all cover the CPT manual. So that is a great study guide for that. The AMA, the AHA, the AHA, ICD-10-CM and ICD-10-PCS coding handbook with the answers, I also recommend. Those links for those particular books are in the description box below. Now, that AHA book, the ICD-10-CM and ICD-10-PCS, that covers diagnosis coding and inpatient procedure coding. Now, if inpatient procedure coding is not covered on your exam, say you're studying for the CCSP or the CPC, you don't have to worry about those inpatient procedures in that book. You can just use the diagnosis portion of that book that they're studying on, right? So, and it goes over it very well. I like the very straightforwardness of that book. I really like those two. I do not recommend any other coding study guides other than those two, okay? And those are going to cover everything that you need, especially if you're sitting for the CCS or the CCA. It's covering that inpatient procedures as well. So that's another thing that, you know, you can have to study with. And also, if you're studying for the CCS or the CCA or even the CIC, the CIC is the Certified Inpatient Coder, and that is the inpatient credential with AAPC. If you are studying for any 3 of those, I do recommend the Optum 360 ICD-10-PCS book, because in the back, it has in Appendix M, it does have a whole list of all of the procedures. It's like a quiz, right? And in the next appendix, it does have all of the answers and the answer key and some rationale to why they got to that. So that is another thing that you can look into if you are going to sit for the CCS, the CCA, or the CIC. You can look at getting that book, because that was what I used to help me to study when I took the CCS last year. And I passed it on the first try. So guys, you need to make sure that you are going through getting that time in. And sometimes people will tell me, well, Blue, 20 hours is impossible for me to do. You know, I just want to, you know, get as little time to prep as I can. Okay, well, really, you're setting yourself up to fail when you don't take the time to practice, because all of that anxiety comes from not being prepared. And what is it that scares us? The things that we don't know, right? The things that we don't know, the things that we do not understand, they scare us the most. But to be confident and to be ready and to feel that readiness, and even though you may, like your body may say, oh, I don't know. But really, when you think about it, you know deep down that you're ready for it when you are practicing with those books. There are no websites that I can recommend, and I will not recommend any websites. I will not recommend anything else other than what I have recommended through the Independent Study Guide, which I have on the channel. You can look through my videos and find the Independent Study Guide. It's the Independent Study video. It's also in the description box of like a lot of my videos too. And it talks about if you're studying independently, you're not going through a program. I list all the books that you need, and I also list some free websites that you can go to, so that way you can download information as well. Look in the description box, because I will not give this over and over again. But research is a part of what we do, guys. It is. In medical coding, we have to know how to do our research. No one is going to spoon feed you all this information. So you have to know where to find these resources. The resources are on my channel in the description box. So just make sure that you check that out, all right? But once you're going through all of those things, you're getting those 20 hours in, you have set a date when you finished your program. You have set a date for, this is the date I'm going to sit for my exam. Then you make sure that you do everything you can to get ready for that date, okay? And then in the week before you take your exam, I recommend a week. I recommend 5 days at least, right? But a lot of people will write me and tell me, oh no, Blue, that's just too long for me. Guys, I'm telling you what I think if you are doing your studies appropriately. Taking the time, taking your breaks, only studying for 1 hour at a time, taking a 15-minute break or a 30-minute break, coming back to it, doing another 30 minutes or doing another hour. You know, as long as you're giving yourself that time to absorb what you've learned, you're not going to burn out. But so many of you like to think, oh no, Blue, I studied for 8 hours straight and now I'm really burnt out. Well, who told you to study for 8 hours straight? And of course you're going to burn out, because now what is going to happen? You are not going to study for days. And now you just lost time. Instead of being kind to yourself, breaking it down, setting maybe 2 hours and breaking that time up so that way that you can absorb everything. You're working on those 10 question coding quizzes, and you're working through those and looking up those codes quickly, so that way you know your code ranges and you're familiar with your books. That way you can, when you walk into your exam, you're going to be ready and you're not going to be afraid, because you are going to know that you've conditioned yourself to learn the material, to be familiar with your medical terminology and your anatomy. And for the things that you don't really recall, know that there are anatomy plates in the medical coding manuals that you can look at. But if you've been looking through your book, you will know. And so many people have told me, well, Blue, I didn't know that that was there. And you've been studying with that book for how long? Okay. So I always say that the opposite of what people are saying, because everybody says, oh, you need to tab, oh, you need to highlight, oh, you need to write. You do not need to do any of those things. If you are studying like you are supposed to, you do not need to do any of those things. And if you have been reading your coding guidelines once per week, like I tell y'all to, some of you do it and a lot of you don't. But for the ones that do it, they're like, Blue, I understand why you say to read the coding guidelines once per week. The byproduct of doing that is that you get faster with reading. Now, if you're taking an AHIMA exam, these are 2 minutes per question. Average 2 minutes per question. If you are sitting for the CPC, that is 2 minutes 40 seconds per question. So you got a little bit more time. Now, not all questions are going to take that long, right? Some you're going to be able to just whip right through. But with the AHIMA exams, you have to answer the question and then move on. You cannot flag. You cannot, put it bookmark. You cannot do any of that. You have to answer the question and move on. Otherwise, you will stay stuck there. So you don't ever want to waste time. Believe in your skill. Believe in the things that you have learned. And if you have been taking the time to study like you're supposed to, this isn't going to be an issue for you. Then you can alleviate a lot of that stress. Again, the slow way is the fast way. If you learn it the slow way and not try to do all these test exam tactics, you're going to alleviate a lot of that stress. I'm just saying, guys. So, I just want you guys to be prepared for success, because it doesn't stop here once you pass the certification exam. Oh, no, friends. When you get your certification and you're out there applying, guess what? Those employers are going to give you those pre-assessment tests. So you can't always have that, oh, I have test anxiety. I have test anxiety. For some people, yes, they have that. It's something with them, yes. But for a lot of people, it is that they're telling themselves, I have test anxiety. I have test anxiety. Your brain can hear everything that you're saying. Every single thing that you're saying, every thought that you have, your brain senses everything. And it's like, okay, we have test anxiety. So what happens? All of a sudden, your heart starts to race and you start to sweat. And then all of a sudden, you can't remember anything because you're so preoccupied with your heart beating really fast and you being really nervous that you're going to mess this test up again. When in actuality, you have been trained, you've been working with your book, you've been working with the workouts that you need to do, and you've conditioned yourself to learn this stuff. So it's time to put those feelings aside and say, you know what, I am ready for this. This is my career. This is what I have spent and sacrificed my time to do. Again, I'm going to talk about time, guys. Time is a precious commodity. It is precious and it is fleeting. And for a lot of you, I see a lot of you wasting time. Just running around, wasting time. Stop wasting time. Because the longer you sit there and you think and you overthink and, oh no, I can't pass, and oh no, I can't do this. Why can't you be preoccupied with, when I pass, my exam on this date, I am going to be whatever your name is and whatever credential you're going to get. You need to put that up where you can see it. People that I have tutored, because I am a tutor, my rate is in the description box below. I've always told people who are, that I'm tutoring, you need to write down your name with your credential that you want. And I know some of them think that it's like that's a little kooky, Blue. I told them do it. That's what I did with the CCSP and the CCS that I did last year. I wrote my name and I wrote my credential next to it so that I could see it every day. So I saw it before I left my house. I saw it when I came in, and I had it in my head every single day. That was my goal. That's what I wanted. If you can see it, you can make it happen. So that is what I want to leave you guys with today. If you can see it, you can make it happen. All of this feeling of, oh no, I have test anxiety, you need to quiet that little person inside of you that is saying all of that, because that is not true. You are ready. And if you are doing the exercise and workouts like you're supposed to, you're going to be even more ready. And if you reach out and ask for help from a mentor or finding a tutor who can help explain things to you, maybe your teacher didn't explain it to you, or maybe you didn't want to ask your teacher, but you would feel more comfortable with a mentor or a tutor, reach out and find one. There's a ton of tutors also on LinkedIn if you're interested. Again, I'm a tutor. My rate is in the description box below. So you have choices out there, folks, to help you to learn. But no one is going to pass this exam but you. No one's going to sit there, taking the test but you. So make sure that you're physically ready and that you've given yourself the appropriate rest. I recommend at least 3 days. At least 3 days of rest. Do not do any studies 3 days before your exam, because you're not going to learn anything new. You need to be refreshed and rested so that when you do go in for your exam, you're going to be ready and you're going to take the world by storm because you'll be ready after having your certification. So make sure you rest, make sure that you take care of yourself, make sure that you study and you practice. And anything that's just excuses, oh, I'm tired, oh, I can't do this, I can't. Yes, you can. Yes, you can. And remember, write down your name and write down your credential, write down the date that you want to take your certification exam, and make it happen. Get it on the schedule, pay for your exam, schedule it, have it ready, and then when that time comes, then you'll be ready. But get yourself on a schedule and get going. I'm just saying. So if this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.